This last time, when I was 44 years old, I had finished a job of covering 2 schools, so I was principal at 2 schools, and I gained like 30 pounds during that school year. So during that summer after that, I started to get back into some kind of healthy shape.
Yeah.
And so I did that. I lost all of the weight and was back into somewhat of a fit state. And at just early in December, first time I noticed it was I was at school at recess time playing some basketball with kids at recess time, and all of a sudden I had this episode of shortness of breath. So I had to sit down, so I went and sat on the bench, and it went away. So that was the first one. The next time was the next day. I was carrying some furniture from our garage into the house, and halfway carrying it, and it was just a chair, so it wasn't that heavy, and I had to stop and rest again. And then there was the next morning, which was a Saturday. I actually was in the basement doing my normal routine that I would do for a workout, and I had to quit it. So it was 3 episodes of things, and it was just shortness of breath. That's all it was. So then finally on the Monday, I went to the doctor, went to the emergency in Rocky, and nothing really showed up until the doctor did a blood test and showed my troponin level was elevated, which is an indicator of some heart trauma. So that was at that point that he sent me to Red Deer, and then from there I transferred down to Calgary a few days later. They did an angiogram and figured out that they couldn't do anything but a bypass operation. So on the 17th of December, back here, I had a triple bypass operation. So. Anytime where you are forced to be off work for, in my case, it was about 4 months, a major operation, right? All of those things, and it wasn't that I wasn't living a healthy life. I just wasn't living to the level that I needed to be with the disease that I was carrying. Right? And, the average person could get by with 4 or 5 30-minute workouts a week. I probably needed 30 to 45 minutes every day. And I wasn't necessarily doing that. I've never smoked, and, in the wintertime I would referee 100, 120 basketball games. So I was doing miles and miles of running, but I wasn't doing it every day, and I wasn't doing it probably to the intensity level that I should have been. I was living, I would say, better than the average North American, but I wasn't living up to the level that my body needs to be. So at that point, I absolutely decided that I didn't have much time left, because I still have some arteries. I have the picture of the angiogram, and there's definitely some areas in there that are still partially blocked, not 40% or 50%, but if I don't take good care of myself from now on, those are just going to continue to build up. And then who knows what will happen. So I'm trying to extend my life as long as I can. We've increased the physical activity immensely. Right? We used to do 7 or 9 or maybe even a 12-minute run every once in a while. We have kids now that are running easily 20 to 30 minutes. And just today I asked the grade 6s and 7s how many of them would like to join a running club, where our finished project would be a 5K run somewhere in Red Deer or Lacombe or something, sometime later in May or June. And 15 of them have signed up for it, because they know that they're that close to being able to do a 5K run. Before that, we would have been doing, the longest might have been, 1 to 1.5 kilometers. Now weekly quite often we go out for a 4K run with our grade 6s and 7s. The experience that I had of completing my first ever run at the age of 47, which was 2 weeks ago at the half marathon, I mean, the feeling that I had from that, I want these kids that are 11 and 12 years old to have that feeling now, so that they will put that type of activity into their regular week schedule or monthly or whatever, and start setting some goals. Goal setting is so important, in every area of your life, but I find now that in physical things it's that much more important. We have to do a better job of teaching the health curriculum and the phys ed curriculum in our schools.
So
educating the youth, for sure. We also have to find creative ways to get to the parents of our kids right now. And I'm trying to do that by going to the parent council meetings, and then I invite myself back, and what I say is, if you've learned something tonight that you think someone else could use, have me back and bring them, And so let's go from a crowd of 10 people to the next time let's have 30 or 40 people, and just continue to spread that message so that more and more become educated. Because we, as a society, we have a deficit in terms of understanding nutrition and the benefits of physical fitness. Adults have to become role models all the way through, right? So I do a little preaching on that when I go and talk to adult groups, that we have to be the role models for our young people. And so those are some highlights. People that have come back now and that they've changed their lifestyle, they've become more active, they've lost weight or whatever the case may be. And so now that it's been 3 years that I've been sharing this stuff, I'm starting to get some success stories that are coming back, and some that are not so successful, some that come back and say, I should have listened to you 3 years ago because I just had a stroke. And those aren't good stories, but they're ones that I can now share with others that, it's never too late to start today. Continue to spread the message. Don't give up. There are changes that are happening, although they are small. But just remember that we can only change one person at a time. We can't. So it will take a lot of time. It's taken our society 40 years, I think, to get to this stage. So we're not going to turn it around overnight. And I use the analogy, it's not a sprint. We're in for a marathon in terms of changing society. So, and never give up on an opportunity to try to help educate someone on the benefits of fitness and eating well. And be a strong role model, and encourage others to join you as well, right? And not in something that would be impossible and painful for them.
Yeah.
Stay in the area. It's important. We need lots of young people in it.